Good day and welcome to another episode of Interface. I'm Kimberly Broderick. Today's guest is the president of the Nurses Association of Jamaica, Carmen Johnson, who will be shedding some light on the dengue crisis faced by the association. Welcome, Nurse Johnson.
Thank you,
It's
and
a
good morning
pleasure
to
to have
your
you.
listeners. Thanks for having me.
All right, let's get to the heart of things, Nurse Johnson. For the viewers and listeners, what is dengue?
Dengue is one of those illnesses that is caused by the Aedes aegypti mosquito. And so basically what it is one that is transferable from one individual to the next. So you need an agent that will move it from you to the other individual. And so the mosquito is that agent that takes it from you to me and from me to somebody else. Simple put, that's how it is. And so dengue is one of those conditions that causes fever. So you'll end up with a fever, it mimics flu-like symptoms, and that is why we're kind of having that kind of mix-up with whether or not I have dengue or not. So it mimics the flu-like symptoms. So you feel malaise, you feel off, you have a temperature, you have a headache, you may have joint pain, you may have muscle pain. Some persons end up with GI problems such as vomiting or nausea. It also comes with a rash.
Oh.
And for some persons, when they are not hydrating themselves enough, you find that many of them end up with sore mouth. And they end up with dry skin, they become delirious, and they become very weak and dehydrated. Not hydrating yourself, not controlling the fever, allowing dengue to progress, it can get to the worst state where you have dengue hemorrhagic fever.
Yes.
And so what it does is that it affects your internal organs, especially your liver. And once it affects your liver, maybe you find that that's where your blood is really put together, simply put, to have the blood circulating. The liver is a bloody, mushy organ. And so you find that when that starts happening, your platelet counts. The platelet is what keeps your blood together.
Okay.
So like it would be like the cornstarch within your gravy that keeps the gravy thick enough.
Yes.
And so when that cornstarch starts getting thinner, then your gravy is watery and then it starts running. And so when your platelet count starts falling, you start losing blood in your various organs. And then you might start having abdominal pain, you may pass out, you start having petechiae, that is the red spots on your skin because you're bleeding from your small capillaries underneath the skin. When it gets to that point, you're at a dangerous level if your platelet count starts falling. And then at that given point, you may require transfusion of platelets.
Oh, and the age group, we've been talking about dengue for months. Who is severely affected?
All persons can be severely affected, but what we are recognizing now is that our 3-year-olds, well, some are 2, but from our 1-year-old up to 18 age group, we find that we have more of those individuals. And then you move to the other level where those who are elderly, in your 60s going up, they are more severely affected because, again, their immune system is not where it ought to be. And so their resistance to fighting off an illness is less than those who are in the middle age group. And so you find that they are more affected, and especially if you have a premorbid, a prior health condition, whether diabetes, hypertension, sickle cell, or any other such illness, you find that because your system is already weakened, it tends to prey on it. And some of these illnesses already affect some of your other organs. And so the other organs not being impacted by dengue makes it even worse for you.
All right. Just to go, Tuesday in the House of Representatives, Health Minister Dr. Christopher Tufton addressed the dengue issue. He said there were 6,114 suspected, presumed, or confirmed dengue cases. And he spoke about the enhanced dengue intervention, $1 billion over the next 3 months. That's the target they're looking at. Do you think that $1 billion is sufficient enough to curb the dengue that we're seeing?
It can be sufficient enough, but as a populace, we need to play our role. Because despite they employ more vector control persons, despite they come out to your property and they come out to your communities, if as an individual we are not educating ourselves as to the signs and symptoms that exist, listening to the news, go to the health centers, listen to the talks that are being given, and recognizing when you are having any of these signs and symptoms to access healthcare early, then it's going to impact you. But it comes down to the community level where you and I live.
Yes.
If we are not ensuring that our environs are kept clean, that we empty the pans, we empty the tires, we empty the drums, and we keep the wastewater away from us, then despite how much money is invested, it is going to prove futile. And so it can be, why I say it can be, if we as a citizen play our part, then it is less work for the Ministry of Health to be doing. But then again, what we find out is that despite we're having the fogging, many communities will tell you that the persons are not coming in early. And you have to fog before these mosquitoes are big and mature in order to get to them. Oh. You have to fog late at night. And so some persons lock up the houses when they come to fog. And so you find that the mosquitoes who are inside are inside. And when the fogging is over and you open, then you have those mosquitoes who are never impacted by the fogging. And possibly what some of us are thinking is that maybe the mosquitoes are becoming resistant to the chemicals that we used to do the fogging. But as a community, each individual needs to play their role. And as nurses, what we've been saying, let us speak to our members in our community, go to the PTAs, and that's what we've been doing, speak to persons in our church, in our various functions, or in our various auxiliaries in the church, have that kind of one-on-one talk with each group that you get to meet. Speak to your neighbor. You may see something across the neighbor. Start being neighborly, because if it affects your neighbor, it's going to affect you because they are near to you. And also seek to go to the neighborhood watch meetings to speak to them about how we do seek to mitigate having Aedes aegypti mosquitoes around us. With the rainy period, what we recognize is that you have more overgrown shrubs. And within those shrubs, you'll find that the place is moist, some water settled. And so if we are not clearing the roadways, we are not clearing the trenches, and we are not clearing the empty lots beside us, then we are going to have a bigger mosquito problem. So it is a thing that all of us have to come together.
Community. That makes perfect sense. So we hold each other accountable in addition. And as you rightfully said, it would make less for the government. All right. Next, opposition spokesman on health, Dr. Maurice Guy. He refuted, though he commended some of the interventions and what the health ministry and Dr. Tufton has been doing, Dr. Guy refuted some claims to say, listen, it could have been prevented if the government had acted sooner. What are your thoughts on that?
I don't know if we can prevent dengue because the mosquitoes domiciliary within our island, but what we can do is mitigate the impact. And what we would want to see is that we are not reactive. And so what we would like to see is an ongoing maintenance program. But what you find out sometimes, because of the resources that is allocated or the resources that exist, though you should be having an ongoing maintenance program, it does break down at some point. And so we tend to become more reactive when the issue hits us hard. And I think the ministry, though, has been doing its part over the number of years, but then we had a period in last year when we didn't act as we ought to have acted or in a timely manner, and so it got out of control from last year, and it is spiraling into this year. Because over my number of years in nursing, last year and this year is the worst I've seen dengue.
Wow. Wow. And we've heard about the dengue-related deaths of children, some early teens, preteens, and so forth. Dr. Guy, he also questioned the statistics. I believe his view is that there are more persons than what the statistics are proven. He also noted that we have to not wait until it's close to home. The death is close to home. We have to act now before, because he feels as if the government or persons won't act until it becomes close to home, until you see somebody who is a prominent or somebody who's close to you die. What are your thoughts on that as well?
And that's not a far-fetched thought, because many persons within this society believe and thinks that way. Because we have been seeing the deaths of our children, we have been seeing the deaths of those who have comorbid conditions, other illnesses, those within the younger age groups that are dying. And many persons feel that we are not intervening as we should because it is not impacting us the way it is impacting those in the community. And what it has impacted my members, because we have had members who have had either their grandchildren or somebody else in the family die from it, or we have had members who have been ill
Yes.
Persons within the medical, the clinical profession have been ill and are ill with dengue. So it is not a far-fetched thought that because it is affecting individuals in this regard and it's not impacting others, that we don't recognize the significant impact it is having. Many of us too are also of the view that the statistics are underreported, but then again, you can't maybe blame the ministry, because what we find out is that the country, the government, the public health system waits and careful on the public health lab to give the results. They don't use the private test kits.
Yes.
And so the result takes a while, they'll tell you, to come back from these labs to the various institutions. And so though you're treating with a number of patients who have the dengue-like issues, they have the hemorrhagic fever, you can't still say this is a confirmed case until you have gotten a result. And so somebody may die from this illness or the signs and symptoms that dengue portray, but you can't say it's dengue because you have not gotten from the public health system that results that says yes, it is dengue. And so based on the fact and the turnover, it can be, and many believe it is underreported based on the numbers of persons that are being admitted, because some wards admit over 100 in a month, over 60, over 50 within a month with dengue-like symptoms.
Wow. On that note, we take a break. Interface will be right back. Stay tuned. Welcome back to Interface. Here with us is the president of the Nurses Association of Jamaica, NAJ, Carmen Johnson. In a recent discovery by Spanish health authorities, they discovered that dengue can be transferred via sex. What are your views on this, Nurse Johnson?
My personal thought process is that it tells you the virulence of the mosquito and the dengue virus that we are treating with. Because if we have gotten to that point where it can be transferred in the semen, then it tells you the virulence, how high it is.
Yes.
And so it gives us a better understanding, a little more understanding as to why these persons are so sick. Because what we're finding out is that once a patient or some of these patients start having a fever, start feeling the flu-like symptom, or feel like they're having the headache,
yes,
by the time they recognize that and seek help, they are so sick. By the time you start intervening, they may crash on you, you have to resuscitate, or you have to be doing things. And so if it can passes that bar and can be transferred in the semen, it simply tells you that we are dealing with something that is not what we are used to being treating with. And so in the given health sector, what we find out is that the whole epidemiology of illnesses are changing. And though it used to affect us and you could take 2 Panadol and you drink some juice and you get it over with, it is making you even sicker than you can even imagine.
Wow. So that has never happened before?
We're not aware of that.
Wow, so this is the first of its kind. Tell the viewers and listeners what are the ways in which dengue can be spread?
The mosquito has to bite you and then bite somebody else.
That's the only way?
I know we are learning that it can be transferred through sex.
So if the mosquito bit me and somebody else, wow. All right, given the rise in the dengue cases and the heavy workload that you and your nurses have to go through, how are you guys dealing with that?
It is just trying to encourage yourself to do what you're called to do, or to do what you have been trained to do. And so compared to last year we lost over 500 of our nurses to resignation. This year we have already gone over 460 up to October for some places. For some places the data we had collected was up to July. So we might be close to 500 again. Having not have that number of persons replacing those who have left the public sector, it simply means that you're working with almost 1,000 less persons than you had last year, January. And so what we also recognize is that we are way below the number of individuals that we require in the public sector. Maybe almost half of those that we need, more than 48% short. So almost half of those that we would need, nurses that we would need within the public sector, we don't have them. So it simply means that you don't have to double up to do 2 persons' work. So like on a pediatric ward that we would have 30 babies or 30 children, you normally strive to have at least 4 nurses the least to see to those patients, which would mean that you'd have 1 nurse to 8 patients.
Yes.
What you're having now is that you may have 2 nurses. Some days you may have 3. And so think about the children who are feeling sicker, because on our wards, they'll tell you up to 70% of the patients who are there are persons with dengue-related symptoms. So think of having those 3 persons or 2 persons to nurse those individuals who are sicker, so they are requiring more attention from you, with less persons, half of the number of persons that you need. It tells you the severe strain that they're undergoing. And so you find that what we do, you'll hear we refer to the word as that we have to do a session. And so for us to do a session is 4 hours, we have to work on for another 8 hours. Because the morning shift may have 3 persons to work, but when you check the evening shift, because persons are entitled to their day off, some persons are sick. You're working with less persons, some persons may be on vacation leave or study leave. You know who have completed your morning shift will now have to stay on, whether or not you want to. It is not a thing of asking anymore, can you? It's a giving, it's a part. According to the nurse, it's become a part, a staple in their daily work life, where they must work on. So you now have to work on until 10 p.m. and hope that somebody else will be present to relieve you, so you don't have to go 3 shifts.
Wow.
And so having to do that 3 days per week, it simply means you are now drained. You are now tired, you are burnt out.
Yeah.
You go home to your family, you don't have time for your young children who have their homework to do, or time to prepare a proper meal, because by the time you go home and to sleep, the nights are shorter. So by the time you go to bed, it's time to get up to go over that whole cycle. Within that 16-hour period, some nurses are lucky if they have the opportunity to have a lunch break or a meal break at any given time. And so you find out that they keep pushing themselves, they keep going. Some put it this way, Madam President, I don't know how long I can continue, I'm tired of it. And I can understand, because every day is the same scenario. So when I can't come on to help you after 3 days, because they must rest, because you have already done 3 15 or 16 hours.
Yes.
Or 3 12 hours per day, 3 12 hours, so that's 36 hours you have already gone. It means that it may just be the 2 of us, because there's nobody else to work on with me for one of the days.
Yes.
So it may just be the 2 of you with that 30 patient or with that 40 patient having to care for. How much can you give? Again, it's not safe for the patient and it's not safe for the nurses. And so we understand the frustration that they're undergoing. We understand their breaking point. And so many feel that the system is just not a system that caters to their well-being or care about them anymore. And so the hope we're having is that many will not see this period as a period to say, let me pack up shop and go. Because it's only going to make it worse for those of us who remain. But they are really feeling it and they are really pressured and they are really under burden. My hope is that after we have gotten the results for those who have sat the last RUNR exam in October, is that the ministry will seek to ensure that the regional health authorities employ these nurses who are available for employment within 3 months of their registration.
That's a call.
That's a
I would like to think that they would.
We have had nurses who have waited a year, 2 years before in employment, because they tell they're only employing on replacement or they're employing based on how they have funds. And so what messes up the system was 2015 coming down, 2014 coming down. You have nurses who left school who successfully completed the exam, was registered with the nursing council, but just wasn't able to pick up a job. And so some have gone into other sectors, some have gone into the hotel sector, private sector, or just changed jobs totally, or some have migrated because they've been waiting for a job and we just want to employ them within the public sector. So that created a messy situation at that time, where people get disenchanted and believe that the public system no longer cares about you or want to employ you, so they start seeking options elsewhere. That having happened created the burden coming down over the years, so persons just get frustrated with how the health system is working and leave. And that is why we are calling on them and we are saying, start the interviews early.
Yes.
While they are waiting on the exam results, start the interviews. Once they have successfully completed, successful in it, and they have registered, then by that given time, it's time now to employ them and start orientating them to your facilities so that they can start working, because we really need the help. And to say that you are recruiting from external sources, that has this challenge, because you have a period of orientation that you have to look into, and this orientation may be longer. And so it simply means, despite that you may employ 200 persons now, they are not yet ready for full service until the next 3 months. So we have a 3-month period where, again, you are still under that burden. You're still having to carry the heavy work pressures before those persons comes in to help you.
And that, would you say that would ease the migration issue that we're facing?
It will ease it for some of our members.
Okay.
Because it's not only the work burden, but also the physical facilities that we work in is a part of the challenge.
Okay.
The way we are treated is a big part of the challenge, both from those who we serve and for those who employ us. And so that's another part of the challenge. While for some of us, again, the remuneration is another big challenge because you have your family, you have your student loan, you have your mortgage.
Yes.
That, or you may have a loan that you want to pay off. So persons will look at other options to ensure that they have a little better life or they have a little more meaningful life. The other issue is that the whole temporary working, where persons are working up to 10, 12 years without being appointed within the healthcare system. So during that period of time, you have no opportunity to contribute to a pension. You have no opportunity to get a meaningful loan to do what you'd want to do, to acquire that asset that you'd want to. And so that frustrates many of our colleagues because they feel that they're all about working for nothing. And so if you don't care to ensure that they are permanently employed, they are going to look where they can get the other benefits from and ensure some return after they have given their service.
So better health conditions, facilities conditions, employment, those would suggest that would curb the migration issue for you
For
guys.
some of us it will. You'll have some who will continue to go because it's a normal trend over the years. But for the others who the system frustrates, it will keep them a little longer if we make the system more amenable to working in.
All right. On that note, we'll take a break. Interface will be right back. Welcome back to Interface. I'm Kimberly Broderick. We are here with the president of the Nurses Association of Jamaica, NAJ, Carmen Johnson. Before the break, Ms. Johnson shed some light on the nurses migrating due to issues with workload and employment. Ms. Johnson, given that nurses have been migrating and been having issues with employment, would you say the dengue crisis that the NAJ now faces have added to those issues?
It has. And because they feel that the system doesn't care for them, the system they are burned out, they feel that if I leave and go elsewhere, where the nurse-to-patient ratio is already accepted,
yes,
and is already known, it is better for me to go. It will give me more time to spend with my family, more time to think what I need to do, and more time to care for myself. And so I've gone to facilities, or I've gotten the call where they're saying, this is it. So it has. And again, because the resources in some facilities are not there for them to work with.
yes.
So that has added to their frustration. So though I don't mind working and I don't mind staying on with my colleague to ensure that the patients are cared for, sometimes what to work with is a challenge.
So that would be addressing the government to use their resources to get you more resources so that you can better the patients.
Right.
There's also a concern that the patients in the hospitals, how they treat the nurses is an issue as well.
That's a big issue.
Is it a case of no respect, not listening? What?
It is a case where I think it's a whole societal issue and persons have not learned to separate how you behave in one area versus how you behave in another sphere. And so persons come into a facility. Take this scenario, we have more patients coming in now.
Yes.
So in your A&E department or casualty department, on a daily basis for most facilities, they may see up to 200 patients. But the space that you have to see these patients in are limited. So you may have only 2 examination rooms for the doctors to work in or for the doctors and the nurses to work in.
Yes.
So I mean, if I only have 2 spaces or 3 spaces, I mean, only 3 persons can be seen at any given time. And not everybody you can get out of that room within 15 minutes or 20 minutes. For some, it's going to take a little longer because depending on what is happening to them and what their complaints are in order for the doctors to be able to put it all together, for the nurses to understand how to charge and to move it to the next system.
Yes.
And so you have an increased work burden coming into smaller spaces to work with. And one of the words, if you say to them when they come in, you will have to wait. That word is a bad word.
Wow.
And that triggers many of the patients. And so they start to quarrel because some persons come and I can understand, but not accepting their behavior that when you come with your relative, it is only your relative that's the sick one there. Everybody else is there to be seen, but mine is the most ill one. So despite you will triage and you'll say to them, despite you'll assess triage, mean assessing the patients and putting them into categories or group to say which one is emergency, which one is urgent, which one is not so urgent, and which one can go to health center. So despite you tell them that, they feel you're shortchanging them. And they will just blow off. When it comes to visiting period, they are visiting hours for the wards. And so persons will come at the close of visiting hours or 5 minutes before visiting hours end and want to do all what they want to do for the patients, want to have the same conversation that they would have had if they had come for the 2-hour period. And when they're asked to wait or to leave, then that becomes another bigger issue. The other part of the issue where we find out that we are given basket to carry water is that, yes, we must educate the relatives and we must educate the patients. But then again, with the number of shortfall in nurses, and it's not only nurses, the medical profession will tell you too that they have been losing doctors because doctors have been migrating. And some get frustrated working in the public sector because of how they're treated, so they leave the public sector and go on private. And so despite that you would want to speak with all the relatives at the given time, it is not possible. Because you have a ward with 40, 60, 70 patients to run. And having concluded that ward run, it may be difficult for you. It is going to be difficult for you to be able to speak with all the relatives that you ought to. And so once the relatives turn up and you're not able to have that wholesome discussions with them, then they feel you're hiding something, you don't care, you're wicked, and they take you on. And it's not just at one institution, it's across the institutions that we're experiencing it. And within health system, I don't think there's much done for the protection of those of us who work within it. And when you are abused, there's not much done to protect us. We have had a number of our members who have had to go to the police station to report the threats, because you have to take the threats seriously. And they will tell you and mark your face when you come out or the watch are going to tell, know where you live. And we have had nurses who people follow them up, because they are so annoyed because they didn't do what they want them to do at the given time, or they feel that the nurse had shortchanged them. They follow them to their home anywhere, it goes like they just stalk you. And so persons have become fearful because of how persons are behaving. And the system itself does not seek to create that protection for nurses. Yes, you'll hear that the facilities have security guards there. But sometimes they are just ineffective. And even if they are effective at the given time, the persons see you as getting the security guard between them and you. And so they don't learn to end their thought process or the upset where it belongs. They carry it forward and continue to be at you. And so that is frustrating many, and because many of our members don't feel safe. Those who see a reason to leave, they leave.
I had a concern earlier about the nurses. Can you confirm if any of the nurses on the wards actually get dengue?
We have had nurses, and we still have nurses who are ill from some of our facilities across the country. And we have had nurses' relatives who have been ill or who have had somebody die from their family because of dengue. So it's not only impacting us with the workload, but mentally and emotionally, it's impacting our members.
So a patient comes in with dengue, actually has dengue, a mosquito probably bites that patient and bites the nurse, and the nurse catches dengue.
The patients in the hospital, I find too that the patients have to understand that they have a responsibility to play in the whole containment of the dengue. So within the healthcare facilities, mosquito nets are provided for these patients in order to protect the other patients and the employees at the facility and the visitors that come. But you find out that despite the education that is given to some of these patients, they are just not compliant. They come from under the net, they pull up the net and they refuse and they fuss. And so that is one of the other challenges that our colleagues have had to be treating within the healthcare facilities. So despite you say to them, clean up your community, keep your place clean, you come into hospital, you say, stay under the mesh. We're not certain if you have it, despite that we suspect that you may have it or that yours have been confirmed. Not many of them, some of them are maybe not many, but some of them are not complying. And so it could be that the nurse picked it up in the hospital, or it could be that they picked it up from in the community.
So what then happens to patients who are defiant? Are there
There's no sanction. You just have to keep educating and hope that they will
They
comply.
listen.
And if they don't listen, you pray and work well and hope that they get better early enough so that they can get out of that space.
Wow. All right. So nurses, what do you want the government to do regarding the dengue crisis in terms of the next step, the next process, how to move forward?
What I think we need to do is that we need more education within the communities, and not just to give out a pamphlet, because for one, we have a society that doesn't read much.
Yes.
And the persons that maybe who are more affected may be the ones who can't read, or maybe have nobody to read them for you. And so we have to contextualize the dengue education in the context of that level of society. So we educate at one level, but we need to educate at the next level. We need to see more. First time I remember we used to have JS coming out and have more public education sessions. We need to go back to this, even though our colleagues are doing, but we need to have more of those education sessions within the community, and not just when they come into the facility or what they may see on the airwaves. But we need to have more of that education. We need to have a fogging program that is not only just reactive, but is consistent throughout the year, so that you can always seek to reduce the mosquito population.
Yes.
Because if we don't, they are going to build up until when things blow out, and then you're trying to contain them. So now it's like you're trying to put 10 pounds of rice in a pot that is only for 5 pounds. And so you're going to have that spillover effect. And so what we want is a consistent program, because up to yesterday, persons have been saying that they have not, despite what is happening in some parishes where the dengue is high, they have not been seen persons coming within their communities to do the fogging. Again, they may have their limitation, but we're hoping that they can beef up and seek to do that. What we want is to ensure that we can have more staff within the healthcare facilities. Encourage those who we have, seek to fix, though we have big plans for the next 10 years, seek to see what we can do now to create that physical impact within the institutions to make life better.
Yes.
All of our hospitals, if you go there, the wards are overfull. So you'll find patients sitting in a chair because there are no bed spaces. So that's the conditions under which we operate. We also want to ensure that, as we're saying, employ the persons once the nurses, once they are successful in their examination, and that they are registered, so that we can have persons who can have that impact in the facilities and have the time also to help to educate the populace.
All right, we're up to another break. Stay tuned. We'll be right back here on Interface. Welcome back to Interface. I'm Kimberly Broderick. The president of the Nurses Association of Jamaica, NEJ, Carmen Johnson, is here with us in studio. Before the break, we spoke a little about how the NEJ has been affected by the dengue crisis in Jamaica. It has been said that dengue is often mistaken for the flu. Ms. Johnson, how can individuals be able to differentiate between the dengue and the flu in order to get the necessary treatment and in a timely manner?
One of the significant difference that maybe persons may pick up is that the flu doesn't come with a rash. And so they may start having a rash in the face or the trunk of their body.
Okay.
Or for some, if you look on the skin, you'll notice that you have little red spots or red areas because you're bleeding. Cause some persons really don't have the pain and the flu-like symptom. They may just recognize that their hand or somewhere in their body just look like they are having some discoloration, whether red or it looks black.
Okay.
It would suggest that they go to the doctor, because simply mean they may be bleeding through the small capillaries. Out of having these signs and symptoms, having abdominal pain, vomiting, what we say to these individuals is go to your health center early.
Yes.
So that at least somebody can assess you and to help you to determine what is it that you're really treating with. So I wouldn't want somebody to just stay home if they start having, and what you find is that with the dengue, the temperature comes on very high. So you may have a temperature of 102, 103. So unlike the flu where you feel warm today and it slowly climbs, with dengue you may find out that you just get a high temperature at one go. You have the joint pains, but what we want to say, I don't want to say to individuals, you determine whether you have dengue or you have the flu. Go to your health center, the nearest health center within your community or close to your community. Speak to someone there and let them help you to determine what is it that may be happening to you. Because what we find out is that many of those who are so ill and in the hospital for a while or maybe have died is that they were trying to figure out what is it that I really have.
Yes.
Or they may have been feeling off, but they said they can wait a little, so they take the Panadol and they wait.
Oh.
But we are saying start taking your Panadols or acetaminophen, not the multi-symptom, the plain Panadol or acetaminophen, and no aspirin. Start taking that early. Make sure you drink as much fluid as you can to rehydrate yourself.
Yes.
So whether it is juice or you drink water, water is very good. Because water hydrates the body. Coconut water has potassium and magnesium in it, so that is very helpful also. Make sure you force yourself to drink, and you must keep hydrated in order to survive. And see your nearest healthcare practitioner, whether privately or to the health center.
Have there been any cases where individuals have died because they were treated for symptoms of the flu rather than dengue?
Well, we have had a few children who we do know that had come in and they thought it was the flu and that it would resolve, was treated, felt as if it resolved, and then they came back to the health facility because now they are still having the signs and symptoms, or it has recurred, only to recognize that they ended up with a low platelet count or distended abdomen, and after that they seek to die. Well, they didn't seek to die, after that they succumb to the illness.
Yes.
And that is why I wouldn't want to say to an individual, you stay home and determine, is this dengue or is this the flu? So once you recognize that your temperature is not abating and it's getting higher, you're getting drier, you're feeling weak, go to the health center so somebody can at least advise you, or go see your medical practitioner so they can advise you as to the next step. Because they can do further examination. We can palpate the abdomen, check the liver size, see what is happening, check your lymph node, and to know whether or not this is something that you really need to treat with. We can look better to see if you're having the bleeding under the skin or if the rash is there but you had not observed it. So we can better advise those individuals to preserve life.
What age group specifically should be looking out? I know for many illnesses, they always advise pregnant women to be careful, children, young girls, especially the elderly as well.
Elderly.
So those persons...
Those are more vulnerable to illnesses. Or they
overall.
succumb more, so we need them overall, but any age group that recognize that you have the signs and symptoms, seek advice early. But our younger children are more affected, and the elderly, the 60s going up, because again your resistance is low, you may have had another health condition that you're treating with. And anybody who have had another health condition with a high blood pressure, diabetes, sickle cell, rheumatic fever, any health condition that you have had before, you find out that you're having these signs and symptoms, go see a medical practitioner.
Or because
or go to your health center.
that might make the condition
worse.
Wow. Wow. All right. What, for the energy, what measures have you guys taken to, one, shield your nurses from dengue and the spread of dengue, or to lessen the effects of dengue on the nurses, on the association?
What we're doing at our meetings is that we speak about dengue.
Yes.
So remind ourselves. We give them the pamphlets, so read for yourself,
Yes.
make sure you're educating within it. And what we have been asking that in-service education officers who are nurses within the institution continue to have that educational sessions with the nurses. We can't shield ourselves from it because we live in the community. And so what we have been encouraging our members to do, as I have said earlier, is to go into your communities, speak to your neighbors, walk around, speak in your neighborhood watch meetings, go to the PTAs, have discussions to educate persons, go into the schools if you can and educate those individuals, and at your church, have those sessions, whether in your family life ministries or your young people ministry, but you educate the populace within your space so that they can understand what is dengue and understand their role in ensuring that we reduce the mosquito populace.
All right, and let's get to know Nurse Carmen Johnson. Why did you choose this line of work?
Which one, president or nurse?
Both. Let's start off with nurses, because you had to be a nurse before you became the president.
Growing up in my community, first I wanted to be a sociologist when I was growing up.
Ooh.
But growing up in my community, I recognized that I was drawn to the elderly.
Which community is this?
That's Town in North Clarendon.
Oh, Clarendon, okay.
And so I would visit those elderly persons around my community. My parents would send us with food or with things to give to them. And then I'd sit and I'd speak with them, and I'd enjoy reading the Bible, listening to history from them, and we'd have those kind of conversation. And so when I go to them, if something was wrong with them, I'd seek to see how I address it and how I treat with it.
Yes.
Somebody may have an injury on the road, and I'm there and I run to help them, or I see them passing and we start to have a discussion. And I remember one particular man in my community, we used to call him Dudes. He would say to me, you know, you're going to be a nurse, you must be a nurse, you know. And he would call me nurse. And I remember when I was at community college, and I went to Knox Community College, and I was doing my A-levels, completing my O-levels that I needed to do. And one of my sisters said, at first I thought student loan mean my parents would go to jail if they can't pay the money. So when I thought of university to go do sociology,
Yes.
we didn't have that fund. And when I thought about it, I said, but if my parents can't pay back, they may just lock them up for the money. So one of my sisters said to me, why don't you go into nursing? Apply to nursing school, since you have always have a leaning to that and persons think you'll be a good nurse. And so I applied, and that was history. And I went into study 1987. And since then, I've been doing nursing.
All right. And as
so maybe
the
I was
NAJ president?
NAJ president, it is a thing that my members called me to do. So despite having been in healthcare for over 20 years, move in the different areas, work in different sectors,
Yes.
When they asked me to do it, at first I was kind of resistive, but then since they see that within me and thinking that, believing that I was the individual at the given time to carry the association to a given point,
Yes.
I allowed myself to serve them, prayed about it, and I allowed myself to serve them. And so that is how I ended up being president, hoping that I'd have concluded my term before, but members thought that no, there's still more for me to do. And so I'm in my third and final term.
You hope it's your final term.
It will be.
Third. Wow. And what has the journey, what's your greatest memory as a nurse?
My greatest memory as a nurse is seeing individuals who we thought would not make it, and when my team on the ward decided, no, we can't allow this one to die, we're going to do everything that we can do for these patients. And we work together as a team. So we don't leave it to your 6 patient, to my 10, but we work together and we say, no, all of these patients must survive and get out of there. And when we see those patients come around and how grateful they are, how the relatives are grateful. And one thing that I enjoy is when I see my past patients, sometimes I don't remember them, and they say, you remember when so-and-so was happening? And because he was there, this is what happened. I like being an advocate.
Yes.
And so my patients will tell you that I've always been speaking up for them. And when nothing is working and they call sister, they call Nurse Johnson, I would go and I'd have that kind of discussion on behalf of the patient and have that kind of intervention that we need to have. And we recognize the changes within the patient. So I like being a part of the healthcare team where we discuss the patients and we look at what is working, what maybe not working, what else we could do, and to get the patient better so that they can go home to contribute to their family.
And take us through a fun moment you've had as a nurse, a fun moment.
Maybe I liked being on the male medical ward. My mental patients seem to think I'm mental too. And sometimes when you go there, the things that they say to you is profound. And so I'll have days when the patients are just acting up. And I remember one morning they were acting up and the police came because they teared on the windows, they teared on the bathroom, and they had implements to injure persons who they feel like they should injure. And everybody was at a standoff. We wanted to get into the patient and they wouldn't. And I remember when I got the call to say, sister, come down to this ward, this is what is happening. And I said, Lord, what is it that I'm going to do? On my way down the corridor, I keep praying. And when I went and I realized the mayhem, they burst the pipe, the water was flooding the ward and whatever. And then when I went and I looked at one of the guys who was standing with the board, and I say, you know, in the name of Jesus, you're going to be yourself this morning. And then he looked and said to me, you're full of demon, you are so demon possessed. And I said, okay, well, my demons are coming into you now. And I remember I said to them, pull the grill, because there was a grill to the entrance. I said, pull the grill. And when I stepped in and he said, you have demons, I said, my demons are stronger than yours. And he said, you know, maybe not pay you no mind, you and your demon. And he dropped the board. And we were able to go in and to create some calm and to sedate the patients. And then when he came around, he said, "Sister, you know, if your demon bigger than for me, demon, if you throw me afraid of you." And I said, "Good." And then I felt that despite he was having his mental moments,
Yes.
he recognized that some things must happen. And having come around, he recognized that, you know, we need to look at life differently. And when I come on the words, like sometimes the things that they would say to me is like they're giving me a message. So you may think, oh, but your head not right. But when you listen to it and you tear it apart, it's like you have gotten a message to take you through the day. And sometimes they recognize that your day is just rough. And they just come out with something to you and you can't help but laugh and just to be relaxed and do what you have got to do.
That's amazing. That's a beautiful journey to be a nurse.
It is. It's just that the challenges makes it difficult. But nursing is wonderful, and seeing the impact that you can have on the lives of individuals, it makes you really want to remain in nursing. And many of our nurses who leave, it's not that they don't want to be nursing, because they are gone to nursing. It's just that the circumstances within which they operate makes it difficult for them to cope.
And many actually do want to serve their country.
We all want to. And 90% of them tell you that we want to have this opportunity, as if you are appointed, we'd stay here. And some will come back, and I'm hoping others will want to come back.
Yes, that's the hope and the dream. Unfortunately, that's it for today's episode of Interface. Join us next time for another episode. Until then, I'm Kimberly Broderick. Thanks to my production and editorial teams. Thanks for watching. Pleasant viewing.